Hi, and welcome to part two of my talk. If you haven't watched part one, my name is Amanda. I'm a PhD candidate in counseling psychology at McGill University and a doctoral psychology intern at the Emotional Health CBT clinic. In part one of my talk, I spoke about panic disorder and what it is. And in the second part, I'll be talking about treatments for panic disorder. So, CBT or cognitive behavioral therapy is a recommended psychological treatment for panic disorder. And just to give you an idea, treatment can last 10 to 15 sessions, although this does vary quite a bit as well. And an overview of the components that are included in treatment are education on panic, cognitive restructuring, which is the cognitive component of CBT, exposure therapy, as well as relaxation techniques can also be included in treatment. In addition to the psychological treatments, there are medications that are sometimes prescribed as well. One in particular are antidepressant medications that are effective at reducing anxiety and panic symptoms as well. And this includes some selective serotonin reuptake inhibitors, so SSRIs, such as citalopram, as well as serotonin norepinephrine reuptake inhibitors, so SNRIs, like venlafaxine. There's also anti-anxiety medications that can be prescribed, which are sedatives. And this can include benzodiazepines, um, like Xanax, but these are more cautiously prescribed because they do have an addictive property to them. So now I'll get into the first component of treatment that I'll be talking about, which is the cognitive component. And this is called cognitive restructuring. So because panic disorder is maintained by catastrophic interpretations of the physical symptoms of arousal, the purpose of cognitive restructuring is to learn how to become more aware of the unhelpful thoughts that are maintaining the panic disorder and develop more balanced and rational thoughts. So essentially, it means modifying the way we think. So, the way cognitive restructuring is done is by examining the evidence of our thoughts, by considering all the available information to arrive at a more balanced perspective or thought. So, what is a balanced thought? Um, it's a thought that takes into account all the information to arrive at a rational conclusion. So, to do this, we would examine the evidence that supports the thought. So, for example, listing the evidence in support of the thought, if I have a panic attack, I will not be able to cope. So, we would examine all the possible evidence in support of that thought. Then we would examine the evidence that is against that thought. So, these are the reasons why the unhelpful thought may not be true. So, the possible evidence that discounts the thought, if I have a panic attack, I won't be able to cope. So, to identify the evidence against the thought, we can start to ask ourselves questions such as these. So, for instance, are there other ways of thinking about the situation? So, an example of this would be, is a heart palpitation always an indication that I'm having a heart attack? Or another one is, does dizziness always mean that I'm going to faint? Other examples are, do I have proof that my panic attacks are dangerous? Will the consequences of a panic attack be as bad as I am predicting? And what would a supportive friend tell me? So these types of questions can open up the door to start arriving at different conclusions about our thoughts and get us to start shifting our thinking to include possible and alternative interpretations. So once we have the evidence for and against the thought, we want to develop an alternative, more balanced thought that takes into account all the evidence. So the evidence for and the evidence against a thought. So the thought here in the bubble, while there is a chance that I could faint during a panic attack, it is very unlikely no matter how dizzy I get. So, this thought will likely lead to more neutral feelings towards dizziness or the physical symptoms rather than a high level of fear, because now it takes into account that possibly the dizziness may not always lead to fainting. So that brings us to behavioral experiments. So, this is when we test out our thoughts with an experiment to determine whether the thought is true. So, this means taking on the role as scientist with our thoughts. So, we're testing out our thoughts to determine their validity. And an example of this could be doing physical activities that increase my heart rate are dangerous. So that is the unhelpful thought. So the experiment in this case could be go for a fast walk or run up the stairs a couple of times. So these experiments are likely to elicit anxiety, but the purpose is to learn whether they are actually dangerous despite our anxiety. And of course, medical conditions that could cause symptoms should be ruled out before trying these behavioral experiments. So it is important to consult with a physician beforehand. So that brings us to exposure therapy. So, because people with panic disorder are fearful of experiencing panic symptoms like dizziness or a feeling of being unable to breathe, exposure therapy is an important part of treatment for panic disorder, and it involves the person, undergoing treatment to be repeatedly exposed to the physical sensations that are feared until these physical sensations no longer elicit the same level of fear. So essentially, exposure therapy is facing our fears. And just like with the behavioral experiments, before doing exposure therapy, any medical conditions such as vertigo or asthma that could be causing the physical symptoms need to be ruled out by a medical professional before engaging in these treatments. So, for panic disorder, the exposure therapy is called interoceptive exposure. So, what this means is exposure to one's internal sensations. So, this is done by artificially inducing the physical sensations that are feared with the goal of learning that the physical symptoms are not dangerous. So, the first step in doing so is to identify the physical symptoms that trigger fear. So, once these have been identified, together with the therapist, a hierarchy of feared physical symptoms will be created. So, this will include deciding on exercises that will trigger anxiety, similarly to the physical symptoms experienced during panic attacks. So, the exposure is a gradual process where individuals are exposed to the feared stimuli or sensations in a gradual manner. So, once the physical symptoms have been identified from least fearful to most fearful, um, the person undergoing treatment will begin exposure starting with the least feared physical sensation and gradually moving their way up the fear hierarchy. So, during exposure, the exercise to elicit the physical sensations are repeated until the fear or anxiety associated with them subsides. So, once the exercises and physical symptoms no longer induce fear, then you would move up to the next exercise on the fear hierarchy. So, for example, if someone is struggling with catastrophic interpretations about dizziness, like if I'm dizzy, it means that I will faint. Then an exercise as part of the interoceptive exposure could be spinning in a chair. So that will actually sort of elicit that feeling of dizziness. Or with hyperventilation. So, hyperventilation occurs when someone breathes too quickly for their body's needs, and this can lead to a variety of uncomfortable physical sensations, which can include dizziness, lightheadedness, chest tightness, sweating, feelings of unreality, and shortness of breath. So, someone can fear the physical sensations that are brought on by hyperventilation as well. So, one interoceptive exposure exercise to induce those sensations could be breathing deeply and rapidly for a certain amount of time, which could elicit that feeling of hyperventilation. And this could be done for something like 60 seconds or whatever works to elicit those sensations. And then another example of a fear of racing heart or increased heartbeat. Uh, someone could engage in an exercise where they would be jogging in place or running up the stairs a couple of times to increase their heartbeat. So, the purpose of these exercises during the interoceptive exposure is to learn that the symptoms are not dangerous because in panic disorder, as I've been talking about, the physical symptoms have been associated with fear and danger. So, we're essentially trying to weaken that association and allow for new learning to occur. So, the purpose with exposure is to allow the anxiety or fear to occur and to experience it. So, with that, during exposure, we want to prevent the use of safety behaviors during the exposure itself. So, I spoke about safety behaviors in part one of my talk. Um, and so, just to recap, safety behaviors are used as attempts to avoid experiencing the feared physical sensations. However, they prevent someone from learning that the physical symptoms are not dangerous. And in that way, they maintain the anxiety and the fear. So they're reinforcing that anxiety and fear. So, the common safety behaviors can include distraction, so mental distraction as well, like imagining that you're somewhere else during the exposure. So, you're sort of distracting yourself, checking your pulse or your maybe not blood pressure during the exposure, but you might be checking your pulse um, and trying to feel for your heart rate, as well as carrying safety objects, so having your medication on you in the event that you might experience panic symptoms, or the need to have someone accompany you during the exposure. So we want to prevent these from being used during exposure because they will prevent someone from learning that the anxiety and the fear is not dangerous. So the exposure is repeatedly done until the physical symptoms or those exercises to induce the physical sensations no longer elicit anxiety, or there's a significant decrease in the peak of anxiety. So, what this graph is showing is that, for one, anxiety does come down. So, it might peak, but it will come back down. And that's what we want to learn during exposure. And then, secondly, with repeated exposure, that peak in anxiety will occur at lower levels with more exposure. So, this is called habituation. So, as we start to do something more or start to expose ourselves to something that we fear repeatedly, our anxiety will lessen with every exposure or over time. So, because it's the fear of the physical sensation that keeps the anxiety going, confronting these physical sensations will allow your anxiety to decrease. teach you that the panic symptoms are not dangerous, and in this way, you may conquer your fears. So, as I mentioned in the first part of this talk, panic disorder can really interfere with functioning because it often leads people to avoid situations and activities in fear that they will elicit those physical symptoms that have become associated with fear and danger. So, for example, they might avoid exercising or playing sports, as well as avoiding watching action movies or scary movies in fear that it could lead to an increase in their heart rate. And another example could be avoiding to go out when you're not feeling 100% okay. So, avoiding these activities that bring on the physical symptoms maintain the fear, which makes it more likely that the panic attacks will be experienced. So, because of this, it's important to confront the avoidance by engaging in activities that may elicit uncomfortable sensations, but also confronting avoidance by engaging in those activities that we might derive pleasure from. And because these sensations may be uncomfortable, they are not dangerous. And then lastly, I wanted to briefly talk about a relaxation technique called breathing retraining. So, breathing retraining can be particularly useful for people who have a tendency to hyperventilate. So, what this is learning to breathe from the diaphragm at a slower and more relaxed pace. So, this is done by inhaling through the nose for 4 seconds, pausing for 2 seconds, and then exhaling for 6 seconds through the nose again. And then pause again, and then you would restart. And a tip when doing breathing retraining is to put a hand on your chest and a hand on your stomach while you're breathing. And the hand on your stomach should rise while you breathe in. So that would be an indication that you're breathing from your diaphragm. And just like with learning any new technique, you want to be practicing regularly to receive the benefits of the technique that you're trying to learn. So you should practice, for example, this relaxation technique daily, so that you can begin to use it during anxiety-provoking situations and it be effective. And just as a note, the relaxation techniques are not intended to replace the behavioral and cognitive components of therapy, but are rather secondary tools that can be helpful for some people to decrease stress and anxiety. So that concludes my talk. Thank you very much for listening. I will be answering questions on October 21st at 7:30 on Facebook Live of the Emotional Health CBT Clinic's Facebook page.